Flockel Show is back, and we would today want to just dwell further or address further the lifestyle diseases. The last videos which we posted in our YouTube channel were to do with cardiovascular diseases. Today, Flockel Show would want to just briefly address diabetes type 2 causes, complications, and management. And what is diabetes? Type 2 diabetes is a chronic condition that affects the way your body metabolizes glucose, or in short, sugar, which is the primary source of energy for your cells, unlike type 1 diabetes, where the body doesn't produce insulin. In type 2 diabetes, the body becomes resistant to insulin or does not produce enough insulin to maintain normal blood sugar levels. While type 2 diabetes can be managed effectively, it requires a long-term commitment to healthy lifestyle changes, and here is an overview of its causes, complications, and management. I first of all look at the causes. Type 2 diabetes is caused by factor number 1, genetic factors. A family history having a parent or a sibling with type 2 diabetes increases the risk. So if in your family you find that there are some family members who are having type 2 diabetes, it is also important you go for checkup. Number 2 cause is insulin resistance. In type 2 diabetes, your body cells become resistant to insulin, and insulin is needed to allow glucose to enter cells to be used for energy. And when cells stop responding to insulin properly, glucose stays in the bloodstream, leading to high blood sugar levels. The third cause is obesity and overweight. Excess weight, especially abdominal fat, is a major risk factor. Fat cells can produce substances that interfere with the body's ability to respond to insulin. Number 4 cause is sedentary life. Lack of physical activity contributes to weight gain and insulin resistance. Physical activity helps increase insulin sensitivity and control blood sugar. So for those who are not going in the field, it is the high time you consider at least making some exercise in the field. The 5th cause is unhealthy diet. A diet high in processed foods, sugars, unhealthy fats, and low in fiber can lead to weight gain and insulin resistance. Excessive consumption of sugary drinks and foods rich in refined carbohydrates can significantly increase the risk. The 6th cause is age. The risk of developing type 2 diabetes increases as you get older, particularly after age 45, though it's becoming more common in younger adults and even children due to lifestyle factors. Cause number 7 is high blood pressure and high cholesterol. High blood pressure or hypertension and elevated levels of bad cholesterol or low density level cholesterol can increase the risk of type 2 diabetes and its complications. And then the last cause, number 8, is gestational diabetes. Women who develop gestational diabetes during pregnancy are at high risk of developing type 2 diabetes later in life. Then quickly I'll look at the complications of type 2 diabetes. If type 2 diabetes is left unmanaged, it can lead to a range of serious complications which may include, but not limited to, the following. Number 1, cardiovascular diseases. High blood sugar levels can increase the risk of heart disease, stroke, and narrowing of the blood vessels. And people with type 2 diabetes are more likely to have heart-related complications, including heart attacks and high blood pressure. Number 2 complication is nerve damage, or what we call neuropathy. Chronic high blood pressure levels can cause nerve damage, particularly in the hands, feet, legs, and digestive system. This can lead to numbness and even loss of sensation, increasing the risk of injury. Number 3 cause is kidney damage, or what we call nephropathy. Diabetes can damage the kidneys filtering system over time, leading to kidney disease or kidney failure. This may require dialysis or a kidney transplant in severe cases. Number 4 complication is retinopathy, or eye damage. High blood sugar can damage the blood vessels in the retina, leading to diabetic retinopathy, which can cause blindness if left untreated. People with type 2 diabetes also have a higher risk of cataracts and glaucoma. Then complication number 5 is poor circulation and amputation. Diabetes can lead to poor circulation, especially in lower extremities. This increases the risk of foot ulcers and infections, which in severe cases can lead to amputations. Complication number 6 is increased risk of infection. High blood sugar weakens the immune system, or you become immunocompromised, making it harder for the body to fight off infections. People with diabetes are more susceptible to skin infections, urinary tract infections, and respiratory infections. Complication number 7 is cognitive decline and dementia. There is evidence to suggest that type 2 diabetes may increase the risk of Alzheimer's disease and other forms of dementia due to the effect of high blood sugar on the brain's blood vessels. Alzheimer's disease is a disease of forgetting, in simple terms. Then complication number 8 is skin conditions. People with diabetes are more prone to skin infections, fungal infections, and conditions like dry skin or itching. This is as a result of the condition being immunocompromised. How then do we manage type 2 diabetes? Managing type 2 diabetes requires a combination of lifestyle changes, monitoring blood sugar, medication, and sometimes insulin therapy. Here are some key strategies for managing the condition. With lifestyle changes, you need to have healthy eating, that is, you take balanced diets, which focuses on healthy balanced diet that includes whole grains, lean proteins, healthy fats, fruits and vegetables. Then we have carbohydrates counting, monitoring the intake of carbohydrates so you don't take too much of carbohydrates, limiting processed foods and sugary beverages. Portion control, eating smaller portions helps prevent overeating and maintain a stable blood sugar level. And then we have increased fiber intake. Fiber helps regulate blood sugar by slowing down the absorption of sugar. Then we have physical activity. Aim for 150 minutes of moderate intensity exercise per week. Activities like walking, swimming, cycling, or dancing can help lower blood sugar levels and improve insulin sensitivity. Then there is strength training. Building muscles. Mass through strength training can improve blood sugar control and boost metabolism. Then stay active throughout the day. Avoid prolonged periods of inactivity, e.g., sitting for long hours. Even short breaks to stretch or walk can be beneficial. Then we have weight management. Losing excess weight can improve insulin sensitivity and help control blood sugar levels. Even modest weight loss, 5 to 10% of body weight, can have significant benefits for people with type 2 diabetes. Then the other thing is stress management. Chronic stress can lead to higher blood sugar levels. Incorporating relaxation techniques like deep breathing, meditation, or into your daily routine can help manage stress. Sleep hygiene. Aim for at least 7 to 8 hours of quality sleep each night. Then we move on to, apart from diet, we move on to the second option, where is monitoring blood sugars. What we have been looking for is only on dietary management. Then the second way of managing diabetes type 2 is monitoring blood sugar levels. Blood sugar monitoring regularly, checking blood sugar levels is essential to ensure that they are within the target range. This may be done at home with a glucose meter or through continuous glucose monitoring device. Then the other way of managing type 2 diabetes is medications and insulin. Several types of medications can help control blood sugar in type 2 diabetes, and common medications will include taking drugs such as metformin, which reduces glucose production in the liver and improves insulin sensitivity, and of course other types of medications as instructed by the medical practitioner. Then we have regular health checkups. Monitor complications. Regular visits to your healthcare provider are important to check for complications such as heart problems, retinopathy, kidney damage, nephropathy, and nerve damage, neuropathy. Then we have vaccinations. People with diabetes are more prone to infections, so getting vaccines like the flu shot and pneumonia vaccine can help prevent illnesses. And then the other way of managing type 2 diabetes is education and support. Diabetes education, learning about your condition, how to manage it, and how to adjust your lifestyle is crucial. And diabetes self-management education programs can help people with diabetes better understand how to control their blood sugar, nutrition, and exercise. Then we have support groups. Joining a diabetes support group or working with a counselor can provide emotional support and motivation. In conclusion, type 2 diabetes is a manageable condition, but it requires commitment to a healthy lifestyle. By adopting a balanced diet, regular physical activity, weight management, and consistent monitoring, people with type 2 diabetes can control their blood sugar and reduce the risk of complications. Medications and insulin may also be necessary, but lifestyle changes remain the cornerstone of effective diabetes management. With the proper management and support, those living with type 2 diabetes can live a healthy, active life. Thank you so much for listening to Flockhill Show. In case you are not affected by these conditions, please share with your relatives and friends. It could help. Thank you so much, and continue viewing our channel. Consider also subscribing to our channel so that we can give you more updates when we upload new videos. Thank you so much.